Hey G Mamas, how are you today? So today is going to be a quite simple and short video about second trimester exams that I had to do as a low risk mama, and maybe you will only have to do the same exams as I did regardless of your age, provided that you are low risk pregnancy. So stick with me and I will show you the 3 exams that I had to go through my second trimester. Okay, so what I had to do. First of all, I'm almost 37 years old, but I am considered low risk pregnancy, which basically means that I don't have to do heaps of exams. And bear in mind that depending where you're watching this video, maybe in your country or even in your state, you will be required to do more exams. First, because you are a geriatric mom, or because of your medical condition, or even because of cultural things. In my case, for example, if I was still living in Brazil, I would be doing ultrasounds pretty much every month, every time that I went to see obstetrician. Not the case here. Okay, so in Australia, after my first trimester, I have much less exams that I have to do. One exam that I had to do was my ultrasound, just to check the heartbeat, and it's about an hour ultrasound where the technician will check heartbeat, fetal growth, will check every organ if it's growing as it should, if the baby is well and the placenta is okay, everything is okay. Funny enough, I thought that would be a ultrasound even more exciting than the 12-week ultrasound, because the baby would be bigger and we would be able to see better features, right? No, actually it's not. You see the baby, which is always exciting. You hear the heartbeat, which is also exciting. But because the baby is much larger now, the ultrasound technician is not able to take a shot or a picture of the whole baby anymore, right? So you only take parts of this growing baby. You take faces and hands, and you can count how many fingers they have, how many toes, and you can definitely see the gender by then if you haven't done the NIP test that I talk about in my first trimester video. So it's not as exciting in terms of seeing the whole baby, unless if you choose to do the 3D ultrasound, which is awesome, but we haven't done it. We didn't think that was necessary. The other exam that I had to do was Bloodwork, which is very common as well, to check if you are anemic, if you need some extra vitamins, and basically how your body is going. And in my case, I found out that I had reduced the levels of iron, and I need to take supplements daily. Now I'm taking twice a day, iron plus vitamin C supplements to recover that. And as you progress in your pregnancy, even on the 3rd trimester, it can go much lower than your 2nd trimester. So make sure you're always eating foods with lots that are rich in iron naturally. And the last exam that I did was the glucose tolerance test, which is different in different countries, but here you fast overnight, you go to do your exam in the morning, you take a blood sample, and after taking that blood sample, you take about 500 milliliters of a sugarish drink, which is disgusting. And if you've been vomiting a lot, if you've been throwing up for everything, maybe you will throw up for that. I'm lucky that I'm not that easy throwing up, and I didn't have a lot of problems with that, and I could hold, but even for me it was really difficult because it's disgusting sweet, really, really, really sweet. And you have to take it in less than 5 minutes as well. So for me it was just like, you know what, I'm just going to scull it, and I took the whole thing. After you take that drink, they come and collect another sample of your blood after an hour, and then some places that's it, you just don't need to do anything else. Some places which was my case, I have to wait another hour and take another sample. So it was 3 samples taken, 1 before the drink and 2 after the drink that I took So 1 hour after and 2 hours after that. So basically take your music, your meditation, iPod and everything, a book that you're reading with you to do the exam, because you will be there around 3 hours to do the whole thing. So that was the last one that I did, and luckily I was fine. I didn't have gestational diabetes. This is why you do this exam, to check if you have any changes in tolerance for your sugar, and if you have to change your diet going forward in your pregnancy. It's very common. It doesn't mean that you are going to be diabetic for the rest of your life. It just means that you are going through a gestational diabetes. And if I had gestational diabetes, I would need to change my diet, and that could be a factor of a little bit of risk for the baby and for myself. It could be impacting on delivery. It could be impacting on the size of my baby. So hopefully it's going to continue like that. But if you are going through a low-risk pregnancy, those 3 exams in Australia, those 3 exams are the ones that you are going to do during your second trimester. Again, if you are in a different country, or maybe in a different state, or maybe if you are a private patient, your doctor will like to ask you for extra exams, or depending on your medical history or your partner's medical history, you will have to do extra exams that I didn't have to do. But basically that's what my GP and midwife group recommended me to do. The only uncomfortable and annoying exam that you will have to do is the glucose tolerance test. It's quite disgusting and a very long process, but it's only for your well-being, so hopefully you will be fine too. If this was helpful to you, please share with other friends, like and comment about your experience. What exams did you do? Did you do something else? Did you not have to do one of those 3? Please share with me about your story. I would love to know about you. And until I talk about my next topic, I will see you then. Thank you so much for watching. Bye.